All right, so you may or may not have watched the videos on the no drugs versus the epidural, but hopefully you got a little bit of insight into the choices that surround, whether you want to have a medicated birth or not. Another choice is where the birth is going to occur. Some people choose to have their babies at home. This is, less than 1% of births occur at home these days in the US. And this is with a burgeoning bunch of people who are willing to have babies at home. It's still less than 1% of babies being born at home. Whereas if you go back 100 years or maybe 110 years, it would be less than 1% were being delivered in hospitals. So we've had a complete changing from, almost exclusively home births to now almost exclusively not home births. In the 1970s, an option appeared that was sort of a hybrid between a home birth and a hospital birth, and that was called a birthing center. A lot of birthing centers are freestanding today, but when they first started developing, they were like attached to hospitals, so you could have, give birth in this kind of separate building that usually is populated with midwives and nurse practitioners as opposed to MD doctors. And so you could deliver your baby in the birthing center. If something went wrong, you could very quickly be transported into the hospital part of the sort of campus, or maybe it might have even been one big building. Today there are more and more freestanding birthing centers, and a lot of people who are giving birth feel like it's a nice option where it's not in their own home, but it feels more homey and less medicalized. So this is the kind of thing that people have to decide is, where do I want to be giving birth? Still, by and large, the vast majority of births occur in hospital settings of one sort or another. A lot of hospitals are recognizing the value of the birthing center kind of feel, and so they've developed birthing wings. I'm in the Spokane area, and one of the hospitals here has a special program for women who are having very low risk pregnancies where they can choose to give birth in a portion of the hospital where they really won't be disturbed by any of the medicalized kind of stuff that oftentimes can surround hospital births. A lot of women are put off by this mindset of, like there's something wrong with you and I'm going to cure you of your pregnancy, when the vast majority of births are uneventful and don't need any kind of medical intervention. But if you need medical intervention, it makes a lot of sense to be someplace where if in an emergency something happens, you're right there and it's available. So that's a choice people have to make. Will the father be present or some other coach? Now, this was a big question. When birthing centers came along in the 70s, along came this idea that dad might be an asset during the delivery of a baby. Doctors had always taken the perspective that, dads will just pass out and then they are going to become their own patient, or they're not going to be helpful, or they're going to criticize the doctor, or other kinds of things that wouldn't be helpful. And so doctors historically were anti-dads being in the room. With the advent of birth centers, suddenly dads started to be present at their births, and so hospitals started to sort of rethink the policy on fathers. And they also started to realize not every mom who's delivering has a father available to assist in the delivery, so it started opening up to a variety of other people who can help. So one thing I want to say is that a lot of people think that if the dad is not present, it's going to somehow damage the relationship between the dad and the child. It turns out that whether dad is present at birth has absolutely no effect on how the dad feels about the baby or how the baby feels about the dad. Bonds between fathers and babies tend to be long-term relationship building bonds. They are not something that happens instantaneously. That happens to an extent with moms, but absolutely not with dads. That's not the important part about having dads in the birthing room. I apologize, my dog's barking again. So what we do know that is beneficial about having dads present is that it improves the bond with the mother. So if you've got the father of the baby and the mother of the baby, they're giving birth to the baby, the dad feels so much more protective of the mother of his baby, whether it's his wife or not. He feels more committed to her. He recognizes that she's bringing his genes into the future at her own peril, and getting to see her go through the process, all these things, it's a huge asset for how he feels towards mom. And, sometimes mom is not the easiest person to support during childbirth. She may say she wants to be touched, but then don't touch me like that. And, it can be kind of an ungrateful kind of feeling. And sometimes dads can get a little nose bent out of shape about it. But, it's painful and it's hard. And so you can't really take anything that the mom says during that time very much to heart. What it seems to bring out in a lot of dads is this sense of protectiveness and this sense of connectedness to this family, especially in the first birth, this family that I've just created. And so it can be this great bonding moment for dads. Now, for the mom, having an advocate there who can explain her facial expressions or can speak on her behalf shortens her labor. Moms who have a person there during labor have hours shaved off of their labor compared to women who are laboring by themselves, which is what, maybe even your mom, but probably for sure your grandma went through, was giving birth alone with her, a doctor and a nurse maybe, and nobody really that knew her advocating for her. So having an advocate really shortens labor. It also reduces reliance on drugs, which is, in the 80s, they made it seem like using drugs would be harmful to the baby. And there's really no evidence that it's harmful to the baby, but it does slow mom's recovery. It's harder on mom if she had to use analgesics or other things, an epidural, things like that. It can be harder on her body in the recovery period. So if she can get through the process without having to rely on drugs, it actually makes her recovery period shorter. So that's a benefit. Now, I just really wanted to emphasize this is true with any kind of birth coach. So if you have a good relationship with your mom and she's not going to worry and fret over you, but will actually advocate for you and like that, she can be a great birth coach. A lot of people realize that, well, my the father of my baby might pass out. My mom might be, too concerned about me and not enough about the process. And so they may bring in what's called a doula, a professional who's going to serve as their coach. Sometimes they'll bring the doula in even while their other partner is there, because they're like, I want to relieve you of some of these sort of, administrative tasks, speaking on my behalf, noticing when I need ice chips. I don't want you to have to worry about that stuff. I want you to be here with me, supporting me, and not like being my servant or having to speak out for me. My doula can do that for me. And so there's a whole group of people that are professional doulas that can come and assist during births. Professional doulas may not be nurses. They may not be trained up midwives. They may just be people who want to support people during birth. Midwives are licensed. They're oftentimes nurse practitioners, and they are focused on a healthy, live, everybody makes it out of this situation. And so they may not be your best birth coach, right? Like having a person whose sole job is to tend to the mom is what I'm talking about. So that can help, mom's entire experience altogether. When the baby is born, a test is administered called the Apgar test. It's called Apgar as an acronym for Activity, Pulse, Grimace, Appearance, and Respiration. So we have this scoring system for each of the different indicators. And so if you have a score, it's administered, by the way, 1 minute after birth, and then again 5 minutes after birth, because immediately after birth we want to assess the health of the baby. And then if anything was less than 2 points, which for most newborns they are at 1 minute, that 5 minutes where they're breathing and they're starting to get with the program, a lot of those things will resolve themselves. So you want to do it 1 and 5 minutes, and they do it exactly like they literally time the moment the baby emerges and do it 1 minute after that, and then again 5 minutes after that. A baby who's got 7 or above is in excellent health at that 5 minute follow-up. That is a baby who's in excellent health. Now you might think, oh, I would want a 10 to be in excellent health, but not necessarily. It's possible that you've got a baby who's being active and has a heart rate over 100 beats per minute, and they're responding when you run your finger up the base, do that plantar test for reflex and things, but they've got some blue extremities, or they're not crying. And so maybe that's why they're scoring a little bit lower. I remember when my son was born, the 5 minute test, I think he got a 9. And I'm like, why'd he get a 9? And they said, well, his extremities are blue. And I'm like, well, I mean, kind of, I guess his forearms were blue. It wasn't his hands, it was his forearms that were blue. Well, it turned out he had really bad bruises from apparently having been stuck on his way out. And so I kind of shows you what a horrible mom I am, because I was like worried that he hadn't gotten 100%. You guys need to give him his point back. This was bruises. This wasn't because of, lack of oxygen. That's so dumb. It's just a test to make sure he's healthy. And they had come to the conclusion he was healthy, and I was fixating on the number. So it's great to be 7 or above. It's not unusual to be, 5 or 6. And especially at that 1 minute, to have a score that's lower that gets better. They want to see that getting better. Unfortunately, some babies who don't get better, they're going to be moved over to the NICU and they're going to have to be attended to because clearly they've got something wrong. So this scoring system allows the medical professionals to make these assessments really quickly right after birth. So let's talk about a couple of problems at birth. So cesarean section is when there's a surgery that goes through the abdominal wall, through the uterus to retrieve the baby that direction. And it's really a very necessary solution when certain problems present themselves, like transverse position in the upper left where the baby is sideways. If it has not rotated and it won't stay rotated head down, it's not coming out. Like that is not going to work. And so a transverse breech baby, that's called, would need to be delivered via C-section. Placenta abruptio is up in the right-hand corner there. And that's where the placenta has started to separate from the uterine wall before the baby's been delivered. And that means the baby is not getting any oxygen during the delivery. And that's a life-threatening situation. So the baby needs to get out. A breech position, now in the lower left corner where the baby's presenting butt first. You would think, well, what's the difference? It's vertical, it should be able to come out. But the problem is that the jaw of the baby can't collapse down to go through the birth canal like the top of the head can. The baby is born with a soft spot so that the plates of the cranium can collapse down and fit through the birth canal. Babies who are born butt first can end up with their jaw catching on mom's pelvic bones. And if that happens, then now we're shoving the baby back in and performing C-section. So generally, if the baby's presenting butt first and it will not turn around, and they usually try it and it's quite painful to try and turn a baby, then a C-section is the correct solution because there's a high risk it's not coming out that way. Placenta previa, which is the lower right-hand corner, you might have difficulty recognizing what you're seeing there. You can see the umbilical cord going across the picture. On the right-hand side is the placenta, and what you're seeing there that's kind of skin-colored is the baby's head. So the placenta is closer to the cervix than the baby is, and so during delivery, the placenta might come out first. And again, now we're going to have a baby who's deprived of oxygen. So that would be a perfect situation for a C-section. Sometimes it's that the baby just in general is not going to be able to make it through mom's pelvic area. There are a lot of things that can make an emergency C-section the only solution. Other things like an active herpes infection. If mom has genital herpes, when the baby goes past it, the baby can actually contract herpes, and the initial infection can actually kill the baby. So the baby needs to come out C-section. If the baby's in some kind of fetal distress, the heart rate keeps plummeting or something like that, need to get the baby out quick. It's really common for C-sections with twins and above because one of them might be facing upwards and one might be facing downwards, and so you may have babies that aren't going to all make it out, or they might be trying to come out at the same time, things like that. So it's just much safer to remove them as a C-section. If mom's in maternal distress, if she's got preeclampsia where her blood pressure is skyrocketing or something like that, the solution is to get the baby out, and so C-section. There's been a controversial rise in rates over the past. I've been teaching human sexuality since 1992, and we were concerned about the maternal C-section rates back then, and it was about 22% of births were being delivered via C-section back then. Now it's pushing closer to 30% of babies are being delivered via C-section. And so there's a lot of concern about why is it raising and is it actually a risky solution? Because this is major surgery and moms die in C-sections. So it's not something to take lightly. Some women are taking it very lightly and they're scheduling C-sections when they have no evidence that they need one, just for their convenience so that their baby could be born on the day that they want or other things like that. So there's a lot of discussion in the medical community about the reliance on C-sections when they may not be actually necessary. All right, let's go ahead and take a break here, and we'll come back and pick up with low birth weight and what is average and so on.